So what age should people be going to the ortho to get something done?
Oh, well, that's a big topic. Now, Google and the majority of dentists say go to the orthodontist after all your baby teeth have fallen out, which is around the age of 12. The American Association of Orthodontists says go to the orthodontist age 7. Well, I disagree. I think age 6, you should be at the orthodontist, get that consultation in to see exactly what's going on. Why? Because then you can do something that's called interceptive orthodontic treatment. Just like in football, you're intercepting. You're intercepting a big problem that may happen down the road. What's the big problem? It's losing your teeth.
Can you share more of the consequences of if you don't go at an early age, like what starts to happen over time?
I do want to show you one of my patients, and this is a too late scenario. She's a wonderful young lady. She's 31 years old, but have you ever seen somebody who has really sunburned skin and you say, wait, that just added 20 years to you? Or someone who drinks a lot and they have a 60-year-old liver and they're probably 20 years old or whatever it is. So this is a case where she's 31 years old and she has the mouth of an old lady already. So she already has severe bone loss. She has recession. She's already really rocking those front teeth. She's going to lose them. This is her side bite. If you could see, she has a severe underbite. So what's happening is the way she's biting, she's just knocking those teeth left and right. And she's wearing down parts of her teeth. So the bite's really off, and that leads to all the problems. This is where all her problems began. She has a severe underbite. She has a narrow upper jaw. And by the way, one more statistic, 80% of the population has a narrow palate, and that affects breathing. And I'll put the publication in the description below. So that brings up a lot of problems as well, because we have so many sleep apnea problems, so many breathing problems, just because they're not getting enough oxygen. But I digress. So if you see her x-ray, the little red dots is where she's already lost 4 teeth. I mean, how did she lose 4 teeth? She has a pretty clean mouth. She brushes, she flosses, but she already lost 4 teeth. So these 4 teeth were lost because of her bite exclusively.
Wow.
And this can easily be fixed between the ages of 6 to 9. And we have incredible technology to really fix it fast in 6 to 8 months. Now she's going to need jaw surgery. She's going to need bone surgery. She's going to need implants. And she needs the whole menu right now.
When this happens, you say, go to the orthodontist. What do they do? What would you do in a scenario where someone comes in at about, 6, 7 years old?
If you notice that children are maturing a lot faster, but also between the ages of 6 to 9, you have that incredible opportunity. I call it the golden window of opportunity. Why? Because the upper and lower jaws are moldable. So your teeth are not going to be in the right spot if your upper and lower jaw doesn't fit together well. So that's why it's such an opportunity to do something very early. And I'm going to show you Victoria here. So Victoria was between the ages of 6 to 9. She was closer to about 8 years old. Now, if you could see, her bite is pretty off. You can't see her lower teeth. So what's happening here? Her lower teeth are hitting the roof of her mouth, and they're also destroying the upper teeth on the back. Now, this is Victoria. This is another view. So she's barely 8 years old. She has a lot of crowding. If she does nothing, what she's going to need extractions later on and a long treatment. Average treatment time for orthodontics is 2 years. Now, we were able to change her life in only 8 months, and we did it with Invisalign. Now, it's very controversial. Nobody knows Invisalign is for kids. They say, well, Invisalign is for adults or teens. But guess what? In 8 months, we changed her life. So this is just 8 months after.
Amazing.
And look at her face. Look at her smile.
Wow.
She's glowing. This is only after 8 months. That's all it took. And you'll say, well, what about pain? Well, the traditional ways of braces, they're very painful. Why? Because we've been using them for the past almost 120 years. Nothing has changed. An expander is 400 to 600 grams of force. Braces are 50 to 100 grams of force. And how much is Invisalign? Is 5 to 10 grams of force. So she barely felt it. It was 8 months. By the time she's a teenager, she will have forgotten that she actually got orthodontic treatment. So it's very important to use the term interceptive orthodontic treatment. That's what you're doing.
And where would people, get a consultation with you? Can you drop a website or?
Yes, of course. StellarSmilesOrtho.com. Stellar is 2 L's. And our handle on social media is Stellar Smiles Ortho, this one word.